my name is Kelsey Sicker. I'm one of the family medicine residents here at Riverside Hospital, and I'm going to be showing you around our family practice center today. So let's get started. The Family Practice Center is the heart of our training experience as our primary outpatient continuity site. We also rotate through a variety of specialty clinics at this location, including sports medicine, OMT, women's procedures, derm procedures, MAT, teen clinic, hospital follow-up, and geriatric assessments. We also have a dietitian, community health worker, and behavioralist available on site. The first space is the waiting area, currently rearranged for social distancing. The front desk is where patients check in or out for appointments. Immediately to the left after entering the practice, we have the Community Health Room, which is the site of our Food is Health program. The Food is Health program is designed to provide fresh produce and non-perishable items for our diabetic patients who screened positive for food insecurity. We distribute these items straight from this food pantry housed right here within our clinical practice center. Under normal circumstances, residents lead group visits for these patients 3 half-days per week, where we provide nutrition education, recipes, and tips on healthy food preparation as part of our community medicine curriculum. Currently, there have been adjustments due to COVID precautions. Making our way a little further into the building, the layout is separated into 3 pods. To the left is green pod, in the center is red, and further to the right is blue. Each resident is assigned a pod at the start of residency to emphasize continuity among patients, residents, MAs, and nursing teams. Next up, we have the preceptor room, probably the center of resident and medical student education here at RFPC. We maintain a ratio of at least 1 preceptor to every 4 residents at any given time. Now let's start to travel towards the patient care areas. We will make a pit stop here so we can see the lab where patients have blood drawn after appointments. There are also supplies in this area, including equipment to perform microscopy. Continuing down the hall, we have made it to Green Pod. Let's take a peek at a typical patient room. There are computers in every room. There are also supplies such as otoscopes, ophthalmoscopes, tongue depressors, speculums, monofilaments, and more. This is an example of the physician workspace. There are multiple areas like this one throughout the practice that serve as the home base for doctors and medical students while providing patient care. Next up, let's head over to the procedure rooms. We have 2 specific rooms with space and equipment for a variety of office-based procedures. Some examples include women's health procedures such as IUD or Nexplanon insertions and removals, colposcopies, and biopsies. We also have the ability to perform joint aspirations or injections, cyst or lipoma removal, skin biopsies, INDs, toenail removals, or suturing. There are also 2 OMT rooms with tables specific for osteopathic manipulation. Our faculty members Emily Gorman and Ben Ahrens lead our OMT curriculum and specialty clinic. All of our residents have the opportunity to learn osteopathic skills. Okay, now starting to wrap up, let's move out of the patient care spaces. This hallway leads to our main teaching space and kitchen area. Here we have the large conference room. This space is the other primary educational site within the practice. This is where we have daily lunch lectures as well as most of our Wednesday afternoon didactics. This next hallway is lined with faculty offices. We are very fortunate to have faculty that are eager to teach and support residents. Their doors are open to residents as often as possible, and they are very conveniently located for us. The final hallway around the corner has additional office spaces, including a few faculty offices as well as the chief resident office space. We also do have a dedicated space that has been reserved for lactation. Alright, well, thank you for hanging out with me and touring the Family Practice Center. To orient us with the surroundings, out this door is an easy route to the main hospital just across the parking lot. Oh, and P.S., residents also do get free access to parking in this lot. We park on the other side of the office to reserve closer spaces for patients, but this is definitely very convenient for us. Thank you again for watching. I hope you enjoyed what you saw, and welcome to RFPC.